Hello, you're welcome again. Let's talk about the symptoms of vaginal burning. The primary symptoms of vaginal burning is a sensation of heat, stinging, or rawness in or around the vaginal area. And this burning sensation can be accompanied by various other symptoms, which can, of course, help us in identifying the underlying cause. You understand? So let's dive into some common symptoms associated with vagina burning. Number one is persistent or intermittent itching in the vagina or even the vulva area. The vulva area is the outermost part area of the female organ, which is often accompanied by burning sensation. Then inflammation of the vulva or vaginal tissue leads to visible redness, that's inflammation, and sometimes swollenness. And changes in the color, consistency, or odor of vaginal discharge. This may include thick, white discharge, which is often associated with yeast infections, thin, grayish discharge with a fishy odor, which is commonly known as bacterial vaginosis. And of course, yellow or green discharge, which may indicate, of course, a sexually transmitted infection, STIs. A burning or stinging sensation when urinating or painful urination, which may be related to urinary tract infection, a sexually transmitted infection or irritation of the vaginal tissue, which can lead to discomfort or pain during sexual intercourse due to vaginal dryness, infection, or inflammation. Then at times it might be sores, blisters, or ulcers in the vagina or the vulva area. Most of the time, this is associated with herpes or sexually transmitted infections, right? Then vaginal dryness, particularly in postmenopausal women that enter menopause, can contribute to a burning sensation and discomfort, vaginal dryness, particularly in postmenopausal women, can contribute a lot of pain and discomfort. And of course, there can be a persistent feeling of discomfort or irritation in the vaginal area. And if it happens, it may worsen with certain activities. You understand? And of course, when we're talking about this, changes in vaginal odor, which may be associated with infection, like bacterial vaginosis. And of course, there can be unusual bleeding or spotting not related to menstruation. You just see the bleeding. It's one of the things. May accompany vaginal burning, especially in cases of infection or hormonal changes. Then at times there can be tenderness or soreness in the vulva or the vaginal area, sometimes making daily activities so uncomfortable and difficult to navigate through. If you are experiencing anything you don't understand, you have taken more remedies and it's not going, see your doctor as ASAP, as soon as possible. See you in the next video.